It's JMP with you here on ESPN 106.3 and the free ESPN app, ESPN WestPalm tonight. And it is time to visit with our friend Dr. Joseph Ricotta, specializing in vascular surgery and endovascular surgery, part of the Palm Beach Health Network physician group, and on staff, Delray Medical Center, and at the Prime Vascular Institute. And Dr. Ricotta joins us now. And Dr. Ricotta, appreciate it so much. And, wanted to talk about, kind of what you do, but also about what Dion Sanders recently went through. Of course, one of the all-time greats in football, and kind of reinventing himself, having a successful career as the head coach at Jackson State. So he recently had admitted that he had 2 toes amputated on his left foot due to blood clots. So can you tell us, obviously you're not, you're looking at it as somebody that, isn't specifically working with Dion Sanders, but familiarize us with kind of, what he may be going through?
Sure. Yeah. First of all, Jeremy, thanks for having me on. So my understanding of his situation was that he had a surgery, and after the surgery, developed a blood clot. And any time that people have surgery where you have prolonged periods of immobilization, if you're laying around recovering after surgery, you can develop blood clots in the legs because, the blood is not moving as well as if you were walking and pumping your calf muscles, which helps propel the blood throughout your body. And you can have either blood clots in the veins, which take the blood from the feet back to the heart, or, which is more common after surgery, or you can have blood clots in your arteries, which take the blood from your heart down to your feet. And in his situation, I think he may have had both, but I know he did have a femoral arterial clot, which means a blood clot in his artery. And if you develop a blood clot in your artery, then that could impede the blood flow that's going down to your leg and foot and toes.
So I guess the follow-up is for someone like him, or somebody like us that has these types of blood clots, is surgery the only option? Or if someone, are there other options, particularly so you may not run the risk of the amputations like you had talked about?
Sure, yeah. So I think, his case is sort of an extreme case. Usually these things do not end up in amputation, but sometimes, of course, they can. There are some prophylactic measures that we can take prior to surgery or prior to a patient sort of being sedentary and immobile for a while to prevent blood clots, but obviously nothing is 100% effective. Normally, if patients develop blood clots in their veins, we can treat them just with some blood thinning medication, either through an IV or through a pill. Sometimes we have to go in there, usually with a little catheter that we can, instead of making a big cut in the leg, we can go in with a little catheter through a little needle poke and basically suck the clot out. So I personally do a lot of those types of procedures in both the veins and the arteries, and those are very effective. In his case, I don't know if they tried to do that, but he did develop what's called Compartment Syndrome, as you mentioned. And what happens with Compartment Syndrome is when the blood, when the leg is deprived of blood flow for a while, or if the blood is not exiting the leg through the veins, you can get swelling of the muscles in the legs. And the muscles in the legs are enveloped within a compartment, a space that's enclosed by what we call fascia, which is a hard covering on the muscles. And so the muscles, when they swell, can only swell so much. And then they are these boundaries of the muscle. And if it swells and it occupies the whole space, then what can happen is it can actually compress all of the nerves and the blood vessels going to the leg and basically squeeze those arteries shut. And so I believe he had what's called a fasciotomy, which is you release those compartments through a little incision, you can release the compartments and let the muscles swell, and then the pressure is released on the arteries, and then all of a sudden the blood is flowing again. In his case, perhaps it was done a little bit, it was a little bit too late to save the two toes, but the rest of his leg and the other toes on his foot were salvaged, fortunately for him.
For middle-aged adults, for people that may have, family history of blood clots, how much at risk are they?
That's a very good question. So there is a genetic predisposition to forming clots. And so some people, you can't do anything about your genetics. And some people are born with specific genes that predispose them or put them at a higher risk of forming clots. Unfortunately, unless you already know that you have a family history of clots and you can go get tested, there's blood tests that we can do to try to identify some of these genes. But sometimes we don't know until a patient has a blood clot and there's no real identifying factor of why they had the blood clot, no inciting factor. Then we do these tests, this blood workup, and we find that they may have the gene. And if you have the gene, then we put them on usually lifelong blood thinner, lifelong anticoagulation to prevent blood clots from happening. So people that have first-degree relatives, so parents or siblings, maybe grandparents, with a history of blood clotting or clotting disorders should be evaluated with the genetic test that, again, we can do by just drawing some blood samples to see if they are at risk. And if they are, then we usually put those patients on prophylactic blood thinner.
Dr. Joseph Ricotta is our guest. Dr. Ricotta, I know, you work with Palm Beach Health Network Physician Group, part of that group, but, you also do so many other things, Prime Vascular Institute in Delray Beach, on staff at Delray Medical Center, teaching at FAU. I got to imagine your schedule's pretty hectic, but, what's kind of, what other things are you working on, aside from, treating obviously blood clots and what we talked about with Dion Sanders?
Yeah, so when I came down here about 5.5 years ago to South Florida, the idea was to really bring new innovative technology down here to the community, to patients with vascular disease. There's a lot of vascular disease down here, and in my opinion, a lot of it is undiagnosed and or underdiagnosed and undertreated. And so we've been able to, at Delray Medical Center and through the Prime Vascular Institute and through our fellowship training program at Florida Atlantic University School of Medicine, we have been able to bring a lot of these new technologies to treat various types of vascular disease, carotid disease and stroke, aortic aneurysms, blockages, not necessarily blood clots all the time, but arterial blockages, plaque buildup in the legs, which is called PAD, or peripheral artery disease, which can lead to amputations. And so we have a lot of new technologies involved in our limb preservation program, preventing people from having an amputation that have this plaque buildup. Pulmonary embolisms, blood clots to the lungs, venous disease, not only blood clots, but also varicose veins and what's called venous insufficiency, which is leaky valves in the veins. We do endovascular robotic surgery. So a lot of the things that a lot of these tools and technologies we've introduced over the last 4 or 5 years in Palm Beach County and in South Florida and in the state and sometimes in the country. We were the first in the country to do endovascular robotics in 2018 at Delray Medical Center. We were the first in Florida to do what's called TCAR, which is a new procedure for stroke and carotid blockage in the carotid arteries, and we're one of a handful of national centers of excellence based on our patient outcomes and volume in the country, in the entire country. And so we've had a lot of firsts at Delray Medical Center and through Prime Vascular Institute, and we've set up training programs not only through FAU, where we founded and started a vascular surgery fellowship at FAU, where we train, future vascular surgeons. It's a 2-year fellowship after general surgery training. But also we have doctors from all over the world come both to Delray Medical Center and Prime Vascular Institute to learn these new techniques and technologies. And so I think the take-home message is that a lot of this wasn't here 5 years ago, and our mission really was to bring the most advanced techniques to the community to best serve our patients with vascular disease.
And the website is primevascular.com. Also, you can call Dr. Ricotta's office, 561-303-0013. Dr. Ricotta, we really appreciate it so much. Thanks for a few minutes.
Of course, anytime. Thank you for having me.